So I think when I'm trying to encourage patients to do an HIV test or do STI testing, particularly with HIV tests though, is just to normalize the conversation around sexuality and their sexual health. So I start with very general questions like, are you currently sexually active? Who are you having sex with? What type of partner is this? Is this a primary partner? Is this a casual partner? Do you have multiple partners? And really just try to de-emphasize or destigmatize the conversation about sex. I think a lot of times we put pressure on ourselves that we really have to dive into the specifics at that moment, and we have to, Mr. Johnson, Mrs. Johnson, are you having anal sex? Is it with a condom or not? And those questions can be very intrusive. So I think starting off with open-ended questions that are a little less intrusive. Do you have any sexual health concerns? Are you currently having sex? And do you have any questions for me about sexually transmitted infections, HIV testing, performance, pleasure? Those kind of things I think will go a long way in opening the door and letting patients know that it's okay to have these conversations. One of the other solutions that I talk about is that I think a lot of clinics do have the capacity with their medical assistants, nursing assistants, other staff members that could ask some of the initial questions up front. And if you're in a very busy clinic where you're seeing 20 to 30 patients a day and you don't have time to dig into all that, maybe if a medical assistant who's already taking vitals for them already can say, hey, do you have any sexual health concerns for the doctor today or for the nurse practitioner or the PA? And we'll relay that to them so that they can add that to what they need to address today. The patients may say, no, I'm actually good today, or I'm actually okay today. And then you can go from there.